Texas Heart Institute, trained at one of the greatest centers in the world, I would say, and I give homage to Dr. Denton Cooley, who recently passed away, famous all over the world, obviously, James Wilderson, so many, Dr. Wilson, Dr. Fish, Dr. Frazier, all of these giants in cardiovascular care. And I'm here today representing their teaching and taking it a little bit beyond about vascular, reversal of vascular disease. Thank you, gentlemen. And today we're going to talk about inflammation, and we are on Zoom, we are on YouTube, I guess. So if people miss this, you can let them know that they can watch it later on. So inflammation, peripandemic, and the role of external counterpulsation. That's my talk for today. And this whole long COVID idea is now so relevant to us because we are in a post-pandemic state. And I see a lot of patients who have lots of different symptoms with that regard. So I started the talk with a slide about SARS-CoV-2, basically. Endothelial dysfunction. So these are terms you're going to hear. Some of you are in medicine, and some of you are my patients, and some of you are on cryptocurrency. So all of you need to understand that the endothelium is the lining of the arteries, and it's the largest surface area of any organ in our body. So endothelium is really important. It's the inside skin. There are cells, and they play key roles in everything that happens to us, whether it's clotting, whether it's constriction causing high blood pressure, whether it's a plaque formation causing coronary artery disease or stroke. And the mitochondria there those are the little engines inside of our cells. Everybody went to school and everybody learned about cells, right? You did, right? And so those cells have engines inside them, and the engine produces lots of great things. Regulatory mechanisms to control inflammation and vasoconstriction or constriction of the arteries.
Okay, we can't see the video.
We can't see the video, so what to do?
It just says mother.
Oh, okay. Somebody fix that. So the mitochondria, when they get sick, that causes a lot of inflammation in our body. And inflammation is very evident now post-COVID. So in the US, I used to do this blood test, you'll see it in a minute, called the PULSE, P-U-L-S cardiac test. So in November of 2019, I started seeing pulse scores that maybe you came to see me and your pulse score was usually around 10, a little inflamed. So we want to get things that are antioxidant and things like vitamin C or glutathione or things that help stop oxidative stress. And external counterpulsation is one of those things that we use, so we'll talk a little bit about that. So that is the root cause of chronic disease. So the goal is preventing chronic disease. So what are the chronic diseases? I see them every day. Dr. Klima, my partner, sees them every single day. Vascular inflammation leading to plaque formation, high blood pressure, diabetes, stroke. So the goal is to alleviate those, lose weight, enhance performance, increase energy. And these are the things that we want to do to stop oxidative stress. So how do we do that? Well, we need to know what are chronic diseases. The immune system becomes weaker, and many patients come to me now, they just have fatigue, increasing fatigue because of oxidative stress, maybe from the COVID virus. And sometimes they feel just tired, watching TV even. So the post-COVID era is providing a lot of new challenges for us to overcome this oxidative stress. The spike came before we knew about COVID because COVID was happening anyway. And it wasn't announced until about March, right? 2020. Yeah, we knew about it then, but I was already seeing it. Yeah, right, it was still, people came to, I looked at oxidative stress for years and years before COVID, but COVID spiked everything, so that's why it's so relevant to talk about this now, because we want to decrease inflammation. So this is the effects of the coronavirus on the cardiovascular system. So when people tell me, isn't COVID just a lung disease or pneumonia? People still think that because they don't know, they haven't been educated. But coronavirus caused all of these problems with thrombus formation and weakness of the heart and arrhythmias and sudden death, people having atrial fibrillation and stroke, heart attack. So it's like encompassed every part of our lives, right? So we need to take hold of this and know how do we combat the effects. And now the world is, demasking and we're trying to get on with our lives, but the effects of the COVID virus or the vaccine will be with us for a lifetime. So we have to combat that now because COVID-19 is a huge cause of oxidative stress. And you can see that here. Many things can cause inflammation and damage to the arterial lining, but COVID tops all the list now. And that's why we don't need to shy away from understanding COVID. We want to take it head on and say the COVID virus, SARS-CoV-2, increases interleukins, increases something called PI1, which is increasing clot formation and lowering things that stop clot, right? That's TPA, leading to thrombosis. How many of you in this room have known somebody who maybe had a heart attack or a stroke after COVID or pulmonary embolus or deep vein thrombosis? We all have, right? Why is that? Because of this phenomenon, the cytokine storm and thrombosis. So remember this slide because it's very, very important. Then we have something called long haulers COVID, right? You all have heard of that now, post-acute COVID-19. And it's not related to the severity. Some people think, oh, well, if I was in the hospital, I wasn't in the hospital, I wasn't on the ventilator, so I'm probably okay. Or I didn't have any symptoms, so I'm probably okay. But you're not, because non-hospitalized patients, women 30 to 40, men 40 to 50, teenagers, all have seen disruption of their autonomic nervous system. So where I am practicing in the German Heart Center, we have this machine called ANS machine. And we measure parasympathetic, sympathetic nervous system, endothelial function, peripheral neuropathies. All of these things are important as patients present with severe fatigue, brain fog, shortness of breath, rapid heart rate, dizziness, fainting, troubles with their digestive system, can't sleep, have severe fatigue. So all of these things are in the post-COVID syndrome. And you can diagnose it with a skin biopsy. You'll see small fiber neuropathy, but we don't need to do that. We know now what's happening. People lose their sense of smell, have difficulty with balance, rapid heart rate, shortness of breath. So ANS testing, if you don't know about it, find out about it. If you know about it, if your doctor does it, get ANS testing. I think every patient should have this in this post-COVID situation. Long COVID, so autonomic nervous system. So looking at the parasympathetic and sympathetic nervous system, easy test. We do it in the office, right there, right, Dr. Klinger? Easy, takes about 15 minutes. And we can know, some of you have that, Sharad, you've had that test. It doesn't hurt you, and then we can know what is going on the inside of you. So I can reverse it, or so your doctor can reverse it. And many doctors are online watching on the Zoom. I challenge you all to evaluate the autonomic nervous system. It'll change your practice, and it'll change the lives of your patients. Now, long COVID syndrome, is it related to microcirculation and endothelial dysfunction? Why are we here today? We want to learn about the endothelium. How does external counterpulsation help the endothelium? How does IV therapy help the endothelium? How does stopping oxidation help the endothelium? So this was about endothelial dysfunction. This was a study in Tunisia, and they looked at long COVID-19 syndrome and found that fatigue, chest pain, changes of the brain were associated with endothelial dysfunction. Who remembers what the endothelium is? Not the doctors in the room. Endothelium, that was the inside skin, right? That's the largest surface area organ of the entire body. So is it important? Yes, right? So they did analysis and they found that endothelial dysfunction and female gender and severe clinical status at the acute COVID-19 infection with the need for oxygen supplementation, they were all independent risk factors for long COVID syndrome. Now again, on the other slide I told you they don't have to be really sick, but if they were, then there was, it showed that they were independent risk factors. So long COVID-19 symptoms, especially non-respiratory symptoms, are due to persistent endothelial dysfunction. I have patients come over and over and over. Doesn't matter if I'm in Dubai or in Houston, Texas. I see the same thing over and over again. So that's why I say You know, God put me in a place to understand this early on, I think, before the virus was a problem for the world. And now we can help so many people along the way. And so inflammation is vascular aging. It's a modifiable risk factor for cardiovascular disease. And when we see endothelial dysfunction on that ANS test or in other tests that we can do, it's really an early warning sign of arterial aging. I see people here in the UAE and in Houston who are younger than me, but maybe look older, or their organs are older, or so I think, wow, they didn't understand about endothelial dysfunction. Maybe their doctor didn't understand. So, as doctors, we have such a responsibility to teach people the way. It's like my dad, who was a wonderful pastor. He taught people the way. So if we don't teach people, then what are we doing, right? And oxidative stress and inflammation are highly responsible for endothelial dysfunction. Now, this is a great slide. It's a cartoon, so everybody relaxes. So it's a cartoon, right? So we can see here, this is how external counterpulsation works, all right? See that bed over there to your left? That's the EECP bed, which you'll learn about in a little while. I'll walk over there and kind of talk about it. But increasing shear stress is what the ECP bed does. So in the artery, with each beat of this ECP bed, when it squeezes the legs and helps the patient to improve blood flow, we're increasing shear stress. And that shear stress, in this model that was talked about by this Dr. Sackner, showed that increasing pulsatile stress increased something called nitric oxide. So all of that is to show you how nitric oxide is increased. We've all heard of nitric oxide, right? There are people buying L-arginine and all of those things to help improve their nitric oxide because that helps dilate the arteries, improves the blood flow to the brain and the heart and everything else, right? So nitric oxide is key. In the US, we have some kind of beet powder product. You may have that here, increasing nitric oxide. So we have supplements that do that. So that is the goal, because nitric oxide, guess what that does? It stops the coronavirus from attaching to something called the ACE receptor on the cell. So nitric oxide is the key, and that's why ECP is key in post-COVID recovery. It's also key, and of course before that we knew it was key in coronary artery disease and stroke, but now it's key in post-COVID recovery or post-vaccine recovery. So how many people in the world have had COVID? Well, we know that number. But how many people in the world have had the vaccine? A much higher number. So it's a pivotal moment for us. Dr. Atif owns a hospital, right? Out in LA, Rehab Hospital. These patients are there. These patients should all be getting ECP. Dr. Klima is cutting on hearts every day. Those patients should get ECP, and they are believers because they're here. My patients in the room, Pastor, you have patients in your congregation, you never know. One of them had a heart attack yesterday, right? And had to have a stent put in, young man of age 40. So oxidative stress is there and you can't see it. But you have to measure it in certain ways, like the blood test that I talked about. And antioxidant therapy is highly important. Now you can say, well, I don't think I have oxidative stress. No, not me, because I'm good, I don't smoke, I don't drink, I don't do anything, right? Well, what about UV light and other medicines and lipids, immune reactions? Some people have lupus, or some people have rheumatoid arthritis. Radiation, stress, insulin resistance. How about people who are not diabetic, but they're insulin resistant? They have a little poochie belly, or their mom and dad were diabetic, so they're insulin resistant already. Smoking, alcohol, biochemical redox reactions. So oxidative stress is in our lives, right? And so every single person in this room, and every single person online, and every single doctor over there on Zoom should be saying, man, I need to check the oxidation of my patients or myself to prevent this huge problem. And we can do testing. There are lots of analytics to do that. Looking at all these reactive oxygen species or superoxide, hydrogen peroxide. These are bad things. Even I speak about fish oil sometimes, and I tell, don't buy fish oil over the counter, because if you open that up and it smells a little fishy, that means there's a lot of superoxides going on in there, and it's already oxidizing. So don't put things that are oxidized into your body already, right? We want to stop that oxidative stress, because we want to stop the injury from the free radicals. So here's that terrible virus that affected the entire world. SARS-CoV-2 binding to the human ACE2 receptor. So the ACE2 receptor, it's a receptor on a cell. And it's supposed to respond to angiotensin-converting enzyme. But the COVID virus goes and snatches it up and goes into our cells. And that's how all that havoc started. And mainly these receptors on the endothelial cells and arterial smooth muscle cells in all organs. What about the COVID vaccine? All right, everybody comes to me and they say, I'm vaccinated. Well, okay, let's talk about that now. So now we're seeing anaphylaxis, increased oxidative stress, clot formation, thrombocytopenia where platelets are going down, nervous system disorders like Guillain-Barré syndrome, and other neurologic disorders with weakness and can't move one side of their body, and myocarditis and pericarditis, where the walls of the heart are becoming weak or inflamed or fluid around the heart. So we see a lot of this. We're not saying that the vaccine was bad, we're just saying now we're seeing the effects. So what do we do as human beings around the world to protect ourselves from the lasting effects of all of this inflammatory? A great way to measure it is the pulse cardiac test, which I talk about. I think somebody on Zoom, just mute yourself. So the pulse cardiac test is protein unstable lesion signal. It was developed by Dr. Douglas Harrington in the United States. He's my friend. And amazing man that put together different biomarkers and different risk factors and came up with a score. And this is tried and true with Cleveland Clinic and other institutions where they have found that the pulse cardiac test is correlating with endothelial damage, inflammation, and identifying the risk of a patient to have a heart attack or stroke. So your friend at age 40, if he had had a pulse score, would have known that there was high risk for having a heart attack, right? We don't want people dying from heart attack and stroke. We want to make that not the #1 killer of men and women around the world. And that's a great way to do it. We do the pulse cardiac test here in Dubai with German Heart Center and Freiburg Lab and a few other labs around in Abu Dhabi. So they know about this test. Every single person. It should be part of the biometrics ID. I had to go get my biometrics because I got my Emirates ID. So, I said, well, what are they going to check? Are they going to check something important? So that's a great question. Question from the audience is CT of the coronary arteries. Great test. But CT of the coronary arteries, if you just do CAT scan without angiogram, you'll just get a calcium score. So calcium score, Dr. Klima knows as a cardiovascular surgeon, calcified vessels are late in the game. So what I look at is the pulse cardiac test early in the game, really early, so we can reverse the vascular disease. And it's a blood test that you can get here in Dubai. So what are the treatments? How can we help this? External counterpulsation is one of them, but we want to think about early. What are the easy ways? Antioxidants that have been proven in the literature by oral or IV route to help stop oxidative stress and inflammation. Balancing the glucose with certain products that help stop oxidative stress and enhance external counterpulsation. Other things like giving the mitochondria. Remember those mitochondria, the little engines in the cell? They're sick. Right after about age 40, everybody has sick mitochondria. It's pretty bad. And that's why we see aging happen so quickly after around age 40 or 35. Cysteine and D-ribose help the mitochondria to make glutathione. if there's anything I love, it's glutathione. And I talk about it day and night all over the world. And people just, they say, you and your glutathione. It's amazing because when we help bring glutathione production to the mitochondria, we decrease oxidative stress because glutathione is the master antioxidant for the entire body. There are oral forms where you can swish and swallow that. I use that in the US on my patients. IV therapy, which is here in Dubai. People do IV therapy here in Dubai with glutathione and high-dose vitamin C. We actually have my own formula from the US, which is, I think, the best because I have put a lot of other things in there to help the cardiac muscle function, systolic function, diastolic function. Many of my patients know about it, and we'll be starting that IV therapy too at the German Heart Center. So I'm so proud of that Dr. Klima and the staff there and the management has said yes, let's do that because it's a great adjunctive therapy to what we do with external counterpulsation. L-arginine, there's a product called NO2 Blast, but you can get any L-arginine that's really absorbed to increase nitric oxide. Remember what nitric oxide does? Stops the coronavirus and the effects of the coronavirus. Nerve and vascular, B vitamin formulations to help decrease homocysteine. Homocysteine is a protein that causes clot formation. And in this room, probably half of you have high homocysteine levels and you don't know. And those are the people who end up developing thrombus, clot formation, stroke, heart attack, just out of the blue. So we should check the homocysteine level on your friend there who had that heart attack at age 40. Diabetic support, mixing things like fenugreek, gymnina leaf, cinnamon, other botanicals that actually have been proven in the clinical literature to lower insulin resistance. So there's a great product called diabetic support. Yes, and people in this room may need that, right? So insulin resistant. I'm not going to ask you to raise your hands, but I know that some people in here know that they have insulin resistance or diabetes, right? Therapy is really kind of cool, savvy, sexy kind of thing, right? But really, it's important to life. And I see a lot of these little IV therapy bars opening up, and I say, well, what do you guys give the patient? And they say, well, give a little of this, a little of that, but it's not really what you need. So it's kind of a waste of time and money, and it's not monitored by a doctor. But in a real clinic, there's a formula. I created one called Cardiogevity. Why? Because I looked at all the formulas and I kind of created one better than that. But in the literature, it's been shown in alternative medicine literature that fibromyalgia, cardiovascular disease, upper respiratory disease, athletic performance, all improve with IV therapy. And now you can imagine, what are we talking about today? Endothelial dysfunction and COVID, right? So post-COVID, people are having lots of inflammation. How do we get rid of it? Through IV therapy. All right, and oral dose of vitamin C can give a little bit of benefit. So after oral dose, the pharmacologic doses of vitamin C is about 9.3 milligrams per deciliter. Now, the non-medical people in this room, you don't know what that means, but it's low, okay? So if you give IV administration of 50 grams, say, of vitamin C, our formula has 25, you'll get a peak plasma level of 80 milligrams. So 9 versus 80 milligrams, we all know that 80 is more, so more is better in this case, because vitamin C was shown to reverse vascular plaque with the data of Linus Pauling way back in the 60s or 70s. He won the Nobel Prize in medicine for reversing vascular plaque. All right, so think about vitamin C in IV form. Its antiviral effect. So patients who had COVID in China or in Europe were getting, or in US were getting IV vitamin C, and I was doing that anyway to protect my patients in my clinic. So my patients really did well. I mean, thousands of patients, maybe a few, maybe one or two, did really poorly with COVID, and those are ones that were not taking this. So IV vitamin C, hugely important. The formula has other things in it that I'll show you. We see decrease in inflammatory markers with glutathione and vitamin C. So that is the key in the whole process of this IV therapy. It's glutathione, vitamin C, and then you have other things to stabilize this plaque, decreasing plaque formation. If you're diabetic or have insulin resistance in this room, and you've had COVID or the vaccine, you should come and see me or see your doctor about stopping inflammation in your body. These are the ingredients in the IV therapy. With L-carnitine, B vitamins, calcium, taurine. Taurine helps strengthen the heart and helps the diastolic function, and vitamin C and glutathione. What is ECP? Okay, so now I'm going to walk over to the ECP bed, so follow your eyes with me, okay? ECP guys and girls. This is amazing technology, 70 years old now, coming from Harvard, okay? The technology, not the bed. The bed is new. And it used to be kind of it was like chambers, you know, and it was really pretty bad. Now it's so easy, like blood pressure cuffs. And the patient lays on the table, and these cuffs go around the legs and around the buttock area, and then it's controlled by that small computer there. And we want to help the blood flow. So in the cath lab, like when Dr. Klima is doing a cardiac patient, and he's got a patient, sick patient, there's something called an intra-aortic balloon pump put in. And that's a pump that's pumping the blood in the resting phase of the heart to keep those coronary arteries open, okay? Because usually when we pump blood, you think that's when everything gets blood, right? All the organs, except the heart doesn't get the blood during the squeeze, it gets the blood during the relaxation. So this is helping relaxation, improving coronary flow, and increasing blood flow around the entire body. We're not going to put you on the bed, don't worry. Okay? I'm the chairman. Okay. I don't know if we don't have a technician here, so we're not going to. We have? Yeah, so we can do that. I'll finish my lecture and we can do that. So what happens is we're changing the pulsation in the aorta, increasing the flow and the relaxation of the heart. So it's an amazing technology study, multiple publications, international publication, and one study showed, I have a slide there, but one study showed they decreased the Canadian class of angina or chest pain with exertion. Patients who had class 3 and 4 angina are really sick. They can't move without having chest pain. And they moved them from class 3 and 4 to class 1 and 2. That's huge. They could walk around, they could pick up their grandchild, they could cook, they could do whatever they, so it improved their life. So that's what external counterpulsation does. 1 hour a day, 5 days a week for 35 sessions. And that is the protocol for coronary disease or heart failure. But in the world of post-COVID, at Merlin and whoever else is going to kind of help support use of this bed around the UAE, we're going to do 4 weeks, so 20 days. In the literature they have shown around a 4-week treatment, and I'll show some of that slides, where patients improve significantly from autonomic dysfunction, dizziness, shortness of breath, palpitations, fatigue, all of that improving, right? So who wouldn't do ECP? Now, who can't do ECP? I told Dr. Klima this. Severe aortic valve leakage. Can't do it. Severe aortic aneurysm. Can't do it because this pulsation will worsen those 2 things. But everybody else can have this extra. Now you can't be pregnant, okay? So, but everyone else, with reason, with your doctor's evaluation, should get evaluated for external counterpulsation. Post-COVID, post-vaccine, very, very important.
Sport people.
What about sports people?
We have a debate about sport.
I had one of the so sports people are dying right from. That's right. There's data in Parkinson's disease and multiple other neurodegenerative disorders as well. So it's not just about the cardiovascular system, but it's about the endothelium. So there is data in the literature about Alzheimer's disease.
Not prevention, they have it already.
It's actually improving the blood flow, the cerebral blood flow. There's definitely published papers on Alzheimer's disease improvement, moving to class 1 and 2. So the green line is what you want to look at. There was a shift after ECP therapy, improvement of function. I mean, if we're going to do something, we want to see the benefit, right? And we want to see proof. So this was an international ECP registry, thousands of patients, pre and post external counterpulsation. So this is why the guys on Zoom, there are a lot of people around the world doing external counterpulsation in India, Pakistan, I think some are in Europe, there's one in Germany. A lot of them are now my friends online because I met them through, all of this ECP lecturing that I was doing, and I found that, there are other people passionate about this. So in this room, you all should become passionate about reversing vascular disease, decreasing inflammation, helping the lining of the arteries. Think about IV therapy and think about external counterpulsation. There are patients who are taking ranolazine. Anybody heard of ranolazine or Ranexa? Ranexa dilates the small vessels, and we don't know exactly how it works, but it has a lot of mechanisms. And we were stunned when ranolazine came because it really helped those patients who had this small vessel disease, chest pain. So ECP improved markers of functional capacity independent of ranolazine therapy. So it means it helped those patients beyond this kind of last-ditch medicine that we were using for chest pain patients. So a lot of patients come to me and they have chest pain. We do their stress test or their angiogram, and they have some moderate plaque, and they go home on some medicine. But that's not the it, right? We have to stop the endothelial dysfunction, and that's where ECP comes along. So the ECP is safe, effective for angina or chest pain, refractory to medical therapies. A lot of patients are on beta blockers, ACE inhibitors, Plavix, aspirin, all these medicines, but they're still having shortness of breath, right? They're still having chest pain, despite the surgery or angioplasty or intervention. I mean, we're great at what we do as cardiologists around the world, but we have not changed the trajectory of death from cardiovascular disease. So we want to make a difference. And this is one great way of doing that, improving functional status in more than 70% of patients, and short-term and long-term effects. But we have to get to the root cause of the endothelial dysfunction or the vascular plaque formation. And ECP should be considered for prevention, early treatment, and the mechanism of action, remember in that cartoon I showed you, increasing nitric oxide, right? So nitric oxide is the key here, and it helps platelet endothelial dysfunction. That means decreases clot formation and lowers the viral burden by stopping the virus from attaching to the cells. Last two slides, okay? I know you guys are getting tired, there's a lot of information. So, there were two papers that I want to show you. This is about EECP as a novel treatment for post-acute COVID. So, that long COVID type of situation, 38-year-old woman who had long COVID. She had COVID in October, and after the acute infection phase, she went home, but she's still having fatigue, headache, body pain, shortness of breath. And then her fatigue just kind of lingered, and she had this brain fog. Anybody know what brain fog is? Patients come to me, they can't really think, it's just kind of foggy, right? It's a real problem post-COVID. So she underwent ECP therapy, and 3 times a week, and see, it's not every day here, she did 3 times a week. After 1 week, her brain fog had improved, and her shortness of breath improved after 1.5 weeks. And after 5 weeks, she returned back to normal health. I have a patient like this, and she did not do the ECP yet. I just treated her with IV therapy and the oral treatments that I talked about, stopping oxidation. She was a flight attendant. She had to get the vaccine to fly. After that, she was severely debilitated. Young woman. So she and her mother would come, and her mother was crying. What do we do? Nobody knows what it is. And I said, okay, let's check it out. Let's look at the autonomic function, oxidative stress. And before I left for Dubai, she had undergone the treatment regimen, and she is maybe 90% better. She wanted to go back to work, and that's even before ECP therapy. So that's a patient in my hand, and I have thousands of stories to tell you like that. Here's another patient with COVID and developed POTS syndrome. This is very important. A postural orthostatic tachycardia. That means when she stands up, tachycardia. And there are a lot of people like that. their heart is just racing. And they don't even go see the doctor. They think that, well, that's just them. No, it's called POTS, and they can faint. And they can faint while driving or doing something and hurt themselves. So she had COVID pneumonia. She was in respiratory failure, and she went to an acute care facility and then a home rehab center, right? So a lot of patients come into rehab after COVID. And she had this brain fog, fatigue, etc. And she had tachycardia and dizziness. So with ECP treatment, she had 15 one-hour sessions over 3 weeks. All right? So she had a 3-week there. I'm proposing that we should do 4 weeks of therapy because the literature is kind of scattered. Nobody knows because it's all new. But her PROMISE score, which is the patient-reported outcome measurement. It's a way that we measure how do patients respond, because everything in science should be measured, right? Fatigue score decreased by 3.6-minute walking, increased by 85 feet, that's huge. And the Duke Activity Status Index of the Duke University evaluation of this patient by that score improved by 15 points, or over 15 points. That's the first reported case of using ECP for POTS syndrome. And there are people around the world who have this kind of dysfunction. Endothelial dysfunction can be seen in multiple chronic illnesses, right? We talked about diabetes, hypertension, hypercholesterolemia. Oxidative stress is a key factor there. And COVID and the vaccine have been implicated in worsening oxidative stress. So it's not enough that we had oxidative stress to deal with after age 35 or 40. Now we have COVID and oxidative stress worsening. Non-invasive testing can evaluate the extent of this oxidation. So remember, go see your doctor. If your doctor doesn't know, call me, text me, we can always talk about it. And early detection and management, highly important for protecting patients against long-term damage of the vessels, heart, and the other organs. That's the end of that. So thank you very much for your attention.